Our approach and our design supports taking care of not just the patient, but their family. We want to include them in decision-making and planning. Having a baby is a challenge, even if everything goes well. Throughout it all, everybody requires the same baseline of support. They have to have space for their families to be there.
The labor and delivery suite, our intended function is that it be more like a home-like setting. It was important for us that we had a space that was bright. So each of the labor and delivery suites have an external window. There is an area considered more family space, which has, a comfortable lounge, chair, sleeper sofa that allows the family to be more comfortable. However, we do know that we have to prepare the ability for it to be more flexible or swing into a high-risk area. Our concept was, in one space, how can we maintain any type of delivery, whether it's that low-risk patient or that patient who has a high-risk, complicated birth and may need additional supplies.
The mother-baby unit houses moms and babies after the mom has delivered. Research has shown that mothers and babies who remain together do much better in their recovery, and so the space was truly designed to keep mom and baby and the family unit together. It's really two patient rooms that have been combined to be one room. So there's definitely a space for dad or for whoever their significant other is, more than enough space for grandmother, grandparents, aunts and uncles to have good bonding time with the baby. And then it also has a way to curtain off mom so that if she needs a nap or if she needs her own special time with baby, family can kind of stay in the room at the other end due to the size of it. So this really enhances the ability to have whoever the mother feels important to be with her during that recovery time.
If you happen to have a baby who needs a newborn ICU, we have the state-of-the-art newborn ICU. It's single room, isolated areas. We're isolating the babies away from infection, from noise, from light sources. We don't take babies to other places in order to deliver services, because every time you move a baby, there's a risk. We bring those services to the babies. We were able to design this whole unit with all those things in mind.
Each of our rooms has a breast pump. It has a refrigerator to store the milk. And when the parents are here, they have the privacy that they can actually feed their baby at the breast, or the mother, for example, might use the breast pump while the father holds the baby in skin-to-skin care. So it becomes very, very family-centered.
When we set out to design the new services for our birthing area, we had two things that were key, and that was after a baby was born, if they needed the services of our neonatology team, we had to be next to the NICU. If a mother was in the hospital because she had a high-risk pregnancy, she needed to be right near labor and delivery. So that helped guide our floor plan. You have labor and delivery in the middle. The moms who are pregnant and being monitored with their high-risk pregnancies are steps away. And on the other side, if the baby gets in trouble after they're born, the NICU is right next door.
There's a lot of patients that we can predict will have problems, and we can get all the right people in the right place. It's a surprise that it's even more important to have the labor and delivery rooms really close to the NICU, because then we can have, on an emergent case, all the right personnel and equipment right there, right at the time of delivery.